I specialize in the treatment of gastrointestinal cancers. What I mean by that is particularly liver cancers, pancreas cancers, and rectal or colon cancers. And then I also specialize in the treatment of brain tumors. In traditional radiation therapy, we would make a treatment plan based on the tumor and the normal tissues of the average patient. And what we do at the Department of Radiation Oncology here at the University of Michigan is focus on individualizing treatment. And this is done by using special imaging techniques that show which parts of a tumor might be active, and then are those parts of the tumor affected during the course of treatment. So partway through treatment, if we see that part of the tumor is resistant to therapy, we can focus our radiation beams on that resistant part of the tumor. And then on the reverse side, if we see that some of the normal tissue is being injured during the course of treatment, we can replan that radiation so as to spare the normal tissues and minimize the injury. One of the greatest advances in radiation oncology in the last 10 to 15 years has been the knowledge that combining chemotherapy with radiation is more effective than either one by itself. I think of it as 1 + 1 = 3. That is, we get more than just the sum of the effects of chemotherapy and radiation against the tumor. And this has been a tremendous advance, with thousands and thousands of patients being cured each year with these new techniques, many of which have been invented here at the University of Michigan. More recently, my research has focused on using what we call molecularly targeted therapies. This is a new kind of chemotherapy that focuses precisely on what makes a cancer cell a cancer cell. Chemotherapy can be very effective, but it tends to affect all cells that divide rapidly. And that explains a lot of the side effects we see from chemotherapy. That's why patients can sometimes have diarrhea or nausea, because it affects all the cells in the body. With molecularly targeted therapies, they tend to focus on what makes a cancer cell a cancer cell. And that tends to decrease the side effects against normal tissues. And in my research, I focus on how to use radiation in combination with these very targeted therapies to produce, maybe I can say 1 + 1 = 4.